This video sponsored by Buymote shopping app. Buymote e-shopping application is one of the online shopping app now available on Play Store and App Store. Hi guys, if you are in NORCET and other nursing competitive exam preparation, then you can join with me for practicing previous year MCQs. Let's start this video. First question is, bilirubin is formed from. Options are option A, heme, option B, globin, option C, transferrin, option D, gastroferritin. This question, the right answer is option A, heme. Next question is, excessive hemolysis may result in the accumulation of which substance in the body? Options are option A, bilirubin, option B, minerals, option C, heme, option D, globulin. Question, right answer is option A, bilirubin. Next question is, the insufficiency of which substance in the blood may lead to edema of the body? Options are option A, albumin, option B, hormones, option C, electrolytes, option D, gases. This question, right answer is option A, albumin. In the blood, albumin helps to maintain blood volume and blood pressure. Decreased amount of albumin cause decreased osmotic pressure of blood, which lead to seep out of fluid from blood to higher osmotic pressure interstitial tissue and cause edema. Next question is, lifespan of fetal RBC. Options are option A, 80 days, option B, 5 to 7 days, option C, 120 days, option D, 100 days. In this question, the right answer is option A, 80 days. Fifth question is, which organ is primary site of hematopoiesis in the fetus before mid-pregnancy? Options are option A, lung, option B, liver, option C, bone, option D, spleen. This question, correct answer is option B, liver. Next question is, normal diameter of RBC. Options are option A, 7 to 8 micrometer, option B, 6 to 7 micrometer, option C, 8 to 9 micrometer, option D, 9 to 10 micrometer. In this question, the right answer is option A, 7 to 8 micrometer. Seventh question is, RBCs are synthesized in the embryonic life by the. Options are option A, yellow bone marrow, option B, yolk sac, option C, red bone marrow, option D, kidney. This question, correct answer is option B, yolk sac. Next question is, normal adult hemoglobin contain. Options are option A, 1 alpha chain and 1 beta chain, option B, 1 alpha chain and 2 beta chain, option C, 1 beta chain and 2 alpha chain, option D, 2 alpha chain and 2 beta chain. In this question, the right answer is option D, 2 alpha chain and 2 beta chain. Next question is, normal reticulocyte count of blood is. Options are option A, 1 to 2%, option B, 5%, option C, 10%, option D, 25%. This question, the right answer is Option A 1 to 2%. Reticulocytes are the last immature stage of a red blood cell which contain fine reticular network. This reticular structure is usually lost before the cells enter into circulation as mature RBCs. Reticulocytes normally constitute about 1% of the circulating red blood cells. Next question is, which single feature of normal RBCs is most responsible for limiting their lifespan? Options are option A loss of mitochondria, option B increased flexibility of cell membrane, option C reduction of Hb ion, option D lack of nucleus. In this question, the right answer is option D, lack of nucleus. In the absence of nucleus, RBC live only about 120 days. Nuclei are important to cell because they control what substance are made in the cell. Without nuclei, cell cannot replenish what substance are depleted into cell. After 120 days, the cell membrane of RBC rupture and die due to decreased cell flexibility.